Hello. Uh, the forearm or the antebrachium has got two compartments. One is the anterior compartment or the flexor compartment. The number two is the extensor compartment or the posterior compartment of the forearm. Now, the flexor compartment of the forearm has got uh, muscles which are arranged in two groups. One is the superficial group which has 5 in number and the deep group which are 3 in number. So, altogether the flexor compartment of the forearm has got 8 muscles in it, and these muscles, these flexor compartment of forearm muscles are more massive when compared with the extensor muscles of the forearm, and these muscles are the anti-gravity muscles. So, these I will talk in detail about the origin, the insertion, the action and the nerve supply of all the muscles of the flexor compartment of the forearm. And these muscles are classified according to their action also. Like if you see the wrist, the flexion of the wrist is brought by flexor carpi ulnaris and the flexor carpi radialis, and the flexion of the middle phalanx is done by the flexor digitorum superficialis. The the flexion of the terminal phalanx is done by or brought by the flexor digitorum profundus and the flexor pollicis longus, and not only that, the pronation of the forearm is done by the pronator teres and the pronator quadratus, and this is very important in the practical exams where you have a minor exercise on the forearm flexor muscles and extensor muscles. So, I will demonstrate you the muscles of the flexor compartment of the forearm, superficial and the deep, on the cadaver, which is very important in the exam, in the practical exam. Yeah. The flexor compartment of the forearm has got two groups of muscles. One is the superficial group, which are 5 in number, and the deep group we have 3 in number. Now, we will discuss about the muscles in detail. I will demonstrate you. The first superficial group of muscle of the flexor compartment of forearm is this muscle. This is the pronator teres. Pronator teres, which forms the medial boundary of the cubital fossa, and this pronator teres muscle, it takes origin from two heads, from the humeral head, from the medial supracondylar ridge, and also it takes origin from the ulna bone, from the medial border of the coronoid process of the ulna, and this muscle, it is getting inserted onto the middle of the lateral surface of the radius bone, and this pronator teres muscle, it is innervated by the median nerve, and the action of this muscle will be like it helps in pronation of the forearm, and it also acts as a weak flexor of the elbow. This is all about pronator teres. Next, coming on to this muscle, this is the flexor carpi radialis. This flexor carpi radialis muscle, it takes origin from the medial epicondyle as a common origin, and the insertion of flexor carpi radialis, if you see, it is getting inserted onto the bases of second and third metacarpal bones, and this muscle is also supplied by the median nerve. The action of this is, it is a flexor of the wrist, and it also combines with the extensor carpi radialis longus and brevis to produce adduction of the wrist. This is the flexor carpi radialis. Next, we have this muscle. This is a slender long muscle which is thin, which is Palmaris longus. This Palmaris longus muscle, it also arises from the medial epicondyle of the humerus, and this tendon, it continues, it moves superficial to the flexor retinacula and continues into the palmar aspect of the hand with the central part of the palmar aponeurosis, and this is also supplied by median nerve, and the action of this muscle, it's a weak flexor of the wrist, and morphologically this palmar aponeurosis, it is a degenerated distal part of the palmaris longus tendon. Next, after this we have this muscle, the most medial muscle. This is the flexor carpi ulnaris. This flexor carpi ulnaris, it also arises from two heads. One is the humeral head. The humeral head will be arising from the medial epicondyle of the humerus, and the ulnar head will be arising from the medial margin of the olecranon process of the ulna, And this flexor carpi ulnaris, when you see, it is inserted onto the base of the fifth metacarpal bone, and not only that, it also receives the insertion onto the hook of the hamate via pisohamate and pisometacarpal ligaments. And this muscle is supplied by ulnar nerve. Okay, this is not by the median nerve, it is supplied by the ulnar nerve. And the action of this flexor carpi ulnaris is, it is acting like a flexor of the wrist, and it also combines with the extensor carpi ulnaris to produce adduction of the wrist. Then moving on to the next group of muscle in the superficial is, the most important is this one. This is the flexor digitorum superficialis. Flexor digitorum superficialis, this muscle, we have 4 tendons. So this flexor digitorum superficialis, if you see, this muscle will take origin from 2 heads. One is the humero-ulnar head and then radial head. The humero-ulnar head arises from the medial epicondyle as a common origin, and the radial head will be taking origin from the anterior oblique line of the radius. And when you see the muscle as it moves towards the digits, this muscle is divided into 4 tendons. So this is 1, this is 2, okay, you can see it, this is 3rd and 4th. So we have 4 tendons. This muscle is made into 4 tendons, you can see. Yeah, it has got 4 tendons. Now, the tendons are arranged in 2 groups, superficial group and the deep group. Now next, when you see the insertion of these 4 tendons, these tendons, one tendon I have made clearly how it get inserted. Yeah. So the superficial flexor digitorum superficialis muscle, on reaching to the palm at the basis of the proximal phalanx, this tendon will split into 2 slips. As you can see here, the tendon is dividing into 2 slips. Yeah. This is one slip and this is one slip, and it is allowing to pierce one tendon, that is the flexor digitorum profundus. This is flexor digitorum profundus tendon. So this flexor digitorum superficialis muscle, it splits into 2 slips, and in between these 2 slips you see this tendon is piercing, which is flexor digitorum profundus, and these 2 slips will again reunite and decussate, and finally they will get attached to the shaft of the middle phalanx of the medial 4 fingers. And the action of this flexor digitorum superficialis is, it flexes the middle phalanx at the proximal interphalangeal joint, and the nerve supplied to this muscle will be the median nerve again. So these are all the superficial muscles of the flexor compartment of the forearm. I repeat once again. So from lateral to medial side, we have, this is Pronator teres, this is flexor carpi radialis, this is the Palmaris longus, then these are all the 4 tendons of flexor digitorum superficialis, and most medially this muscle is flexor carpi ulnaris. This is all about the superficial muscles of the flexor compartment of the forearm.